Good evening, everybody. Welcome to BirchBark's education webinars. I'm Dr. Marianne Birch, and I welcome you to this opportunity to become a better advocate for your pet and learn a little bit more about how to monitor pets and take care of them with love in our hearts. And speaking of hearts, that's the topic tonight. We have Dr. Hayley McDonald, who is a mobile cardiologist in the area and a very welcome addition to our community. She's got a pretty impressive background. Dr. McDonald grew up in New Zealand and got her veterinary degree from Massey University, and then went on to get a PhD. So we get to call her Doctor, with two doctorates here. And her PhD was at the University of Queensland, and sounds like a fascinating topic of novel therapeutic strategies for human patients with coronary heart disease. And then it wasn't enough. So she went on to get, she went over to the UK, went to University of Glasgow to do a residency in cardiology, and is now boarded in the European College of Veterinary Internal Medicine, Cardiology, which is not an easy task for any of us to get through all of that testing. And then after completing her residency, she stayed on and worked in a private practice that does some mitral valve replacement surgeries, which is pretty cutting edge stuff that's done in the cardiology community, and pretty impressive. So we're very lucky to have her have decided to move to the Central Coast of California in 2022. And she runs a practice called HeartHealth Veterinary Cardiology, and comes in mobily and helps a lot of veterinarians help their patients with echocardiograms and cardiac consults. So we're very much looking forward to the information she's going to share tonight about heart murmurs in dogs and cats. And without further ado, Dr. McDonald.
Thank you very, very much for that lovely introduction. Thank you, everybody, for coming and attending this evening. I'm super excited to be here and really grateful to have the opportunity to chat with you about something that's obviously very kind of close to my heart and our pets' hearts, as you may. And as the title mentions there, we're going to talk a little bit about heart murmurs in dogs and cats. This is going to be reasonably sort of broad overview of things, and of course we're going to have a lot of chance for questions as we reach the end of the presentation. So please feel free to ask away. Happy to answer any questions. So here was a little bit of an introduction about me as well. But yes, I am originally from New Zealand, although to be honest, it's been quite a while since I've been living in New Zealand. Spent a lot of time traveling, mainly to finally achieve my dream of becoming a veterinary cardiologist, which was a dream from way many years back. So spent a couple of years in certainly a number of different countries, and now finally super keen, excited to be here in California. I love it here. I'm an avid surfer and kite surfer, so I love being located here. And as Dr. Birch mentioned, we've opened up a cardiology service, which really the aim is to really try to provide accessible care to pets that need specialized cardiac care. So without further ado, we'll talk a little bit more about heart murmurs. So what is a heart murmur? Well, you probably know a heart murmur is an abnormal sound that your vet can hear when listening to your pet's heart with a stethoscope. So typically we hear two distinct heart sounds when we're listening to a normal cat and dog. And I'm going to attempt to play this. I know it's quite quiet. I tried to increase the sound, but the typical sounds that we hear, we term lub dub, and you would have heard that da 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 there. So when we have a heart murmur, what is this? Well, this is an extra abnormal heart sound, and that's often heard, or most commonly heard, between that lub-dub, lub-dub, lub-dub. It often has like a whooshing or swooshing quality, and can also drown out those normal like lub-dub heart sounds. So you may hopefully be able to hear this, but it's... If we move on to what actually causes a heart murmur, well, the short answer to this is turbulent blood flow. Now, if we think about a stream or a river with the, not blood, with the water flowing nice and calmly, we can sort of mimic that in the heart. The normal blood flows through the heart normally in a really nice sort of quiet, smooth manner. We call this laminar heart flow. However, if we have something obstructing that flow or altering that flow, so think of it in a river where we might have like some obstacles, big rocks, narrowings, or other sort of obstacles that can create rapids. This disrupts this smooth laminar flow, and that creates turbulence. The same sort of thing happens in the heart with blood flow. And if we have this sort of turbulence caused by these abnormalities in the heart or changes in the heart, that can emit sounds, or this turbulence emits sounds, and we can hear that turbulence by listening with a stethoscope. So if we take it back to a little bit of anatomy, I don't have a pointer there, but I'll chat through it. So the dog or cat heart has 4 chambers, similar to the humans. We can divide that into both sides, so the right side of the heart and the left side of the heart. And if we follow the blood flow, so first when we have the blood entering into the right side or the right atrium, then it passes through a valve called the tricuspid valve. You can see that on the left side of that diagram there. Then the blood then moves into the right ventricle, and that's pumped through the pulmonic valve into the lungs, where it picks up oxygen and gets rid of some of the waste products, including carbon dioxide. Then that blood moves from the lungs into the left atrium, which is sort of a reservoir chamber. The mitral valve then opens, allowing blood to flow into the left ventricle. That mitral valve closes, and then that nice oxygenated blood pumps through the aortic valve to the rest of the body. So the purpose of these valves is to keep this blood flowing forward in the circuit and not allow sort of backwards movement of the blood. If, for example, a valve malfunctions, like it doesn't close properly or it doesn't open properly, this can disturb the blood flow enough to create turbulence in some instances, and that will result in your vet hearing a heart murmur. And that's most commonly why we hear heart murmurs in dogs, particularly, which is associated with these leaky mitral valves, or this valve on the left side of the heart. Other reasons that we might have a heart murmur occur or turbulence occur is if there's holes between 2 chambers of the heart, or sometimes if there are arteries that have flow connections between them, which shouldn't normally have connections. And then other times we can have sort of narrowings or what we call stenosis that creates like a sort of pinching effect, like when you put your thumb over the end of a hose pipe and the water increases in speed past your finger, similar to that. And then there are finally other reasons why we can have some turbulence if we have the blood that's too thin, or an anemic patient, or quite commonly actually patients that can be very excited or anxious. This can cause the heart to sometimes pump harder and faster. We can hear that as a heart murmur. How do you know if your dog or cat has a heart murmur? Well, as you know, your veterinarian will be completing a thorough physical examination where they'll listen to your pet's heart and lungs with a stethoscope. Typically, like this will be a general wellness review or like vaccines, etc. When we listen to the lungs, we're listening rather for abnormal lung sounds. These are important because this could indicate in our heart failure patients or advanced heart disease patients a buildup of fluid in the lungs in some patients. When we are listening to the heart, we're listening for that regular lub-dub sounds, and we want that to be at like normal speeds with no abnormal rhythms or sounds that are detected. So those types of things may indicate that heart disease may be present. Other times you may present, or your pet may be presented to your veterinarian with signs consistent with heart disease. So perhaps fainting or difficulty breathing, potentially coughing, bloating of the belly, and then by listening, they'll detect a heart murmur potentially. Now, if we do detect a heart murmur, what we want to do is try and understand in a lot more detail what the characteristics of that heart murmur are. So typically, and it would be quite common that your veterinarian will grade the heart murmur, and that is usually on a scale of 1 to 6, 1 being a soft murmur, soft intensity, and this can sometimes be found in healthy animals, whereas a grade 6 out of 6 murmur is the loudest grade of murmur, where actually we can also feel the heart murmur. Other things about the murmur characteristics that can help pinpoint what part of the heart is disease is where it's actually coming from, where we can locate it with our stethoscope, and the timing of the heart murmur. Does it occur between the lub-dub, which is the typical timing, or does it occur between those two heart sounds? So if your vet does detect a heart murmur, what will commonly will be done as the next test would be performing chest x-rays. So chest x-rays can allow us to assess the shape, the size, and the location of your pet's heart. They're also really important for assessing the lungs, if we're looking for signs of congestive heart failure or fluid buildup in the lungs. And they also look at the blood vessels as well. So the other reason is sometimes we may have a pet that comes in with an asymptomatic heart murmur and, for example, a cough, and we find actually by chest x-rays that it's potentially the primary culprit is something else. It's maybe there's something stuck in the throat, or there's primary lung disease, which we suspect is the main cause of the signs. So chest x-rays are really a useful diagnostic tool. And then usually we'll have a referral to a cardiologist for an echocardiogram to try and identify definitively the cause of the heart murmur, and then try and understand, is this going to affect my pet's health, and are any treatments or management plans needing to be put in place? So an echocardiogram is a kind of fancy way of saying ultrasound of the heart. It's a non-invasive procedure where your pet usually lies awake on a nice padded table. We try and have it really calm and relaxed, like minimal noise in the room where we're performing the echo. It's uncommon, but sometimes we may need to give a light sedation to help calm the pet during the procedure. And then typically we'll apply some alcohol, or sometimes do a little clip of the fur to allow us good contact with our ultrasound probe. Now, to do the echo, how does this work? Well, the echo uses or forms a picture essentially by sending sound waves. These are harmless sound waves into the body, and then interpreting how they bounce back. And then the echo allows us to view the heart, the pumping heart, in real time. It allows us to assess the heart chambers, essentially the health of the valves, by looking at the thickness and any abnormalities of the valve leaflets. It allows us to also look at the thickness of the heart walls, particularly important in patients like cats, and then other detailed anatomy. So in the top video, we have an ultrasound image, the two, oh, yes, I think you can see this. So this is the left ventricle, this is the left atrium, this is the mitral valve, and the valve here, the anterior leaflet, is moving very vigorously and what we call prolapsing, or moving into this left atrium chamber, which normally it sits in this sort of plane. So we can assess that valve movement is abnormal, that valve is thick, and this patient has mitral valve disease, which we'll talk about later. Doppler ultrasound, or Doppler technology, also allows us to assess and track the blood flow through the heart. So the second picture here is a example of what we call color Doppler. So the colors are used to indicate specific direction of blood flow, and that allows us to see if there's any leaks through the valve. In this patient, that green color there, that's the leak that's occurring. And it also allows us to assess how the blood's moving out of the heart, if there are any like holes or abnormal connections in the heart. So the echo is really important to sort of definitively show us what's created the heart murmur and how the heart's functioning. Then, because we know that each patient requires sort of individual medicine and medications or treatments tailored to them as a specific patient, we want to understand their specific problem so we can provide the best or optimized sort of treatment plan. So the echoes are really useful to help us determine those plans, or it can help us assess like ongoing management of the pets and if we are being effective in some of our treatment plans, or if we need to adjust some of our medications. Similarly with x-rays, they are very important. So what does a heart murmur mean for my pet? Well, actually, a lot of heart murmurs are harmless, and some or many may not require any treatment, but others certainly can be a sign of really serious disease, which may require lifelong treatment, potentially surgical intervention, and in some cases may affect the lifespan of the patient, sadly. These murmurs, they can affect patients of any age and sex, so kittens, puppies, older patients. We do know that some breeds are more prone to certain heart conditions. And we recognize that there are different causes of heart murmurs. So when we have a heart murmur detected at birth, we call this a congenital heart murmur. This is associated with a heart defect that the pet was born with. And sometimes actually we don't always pick these up as puppies or kittens. Sometimes they're overlooked, and the murmur might actually be first detected later on in life for some patients. However, the vast majority of heart murmurs are detected in older patients, older dogs or cats. These are developed later in life, and we term these acquired heart murmurs. Although these can be benign, more often they are associated with sort of developing heart disease. What is a benign heart murmur? Well, as it sounds, there's usually there is no apparent heart disease present that explains the murmur. They're usually puppies. They're usually soft murmurs, but they can quite commonly occur in cats of any age. Pleasingly, they're no cause for concern and can often be intermittent as well. What can be sort of challenging is sometimes or often it can be difficult to actually distinguish between a benign heart murmur just from listening with a stethoscope to a murmur caused from a sort of more low grade or less severe congenital heart lesion. So the echo's useful to confirm that diagnosis. Oh, if you can hear that, that's a very soft heart murmur there, benign heart murmur. Now, congenital murmurs, yes, congenital murmurs, as I mentioned before, they're associated with these heart defects that the pet's been born with. This is a really challenging situation because often we have a new puppy full of hope and joy and excitement, and then they're normal. They're running around, they're playing, look like nothing wrong, and then a heart murmur is detected. And sometimes these heart murmurs can actually be indicative of potentially terminal disease. So really, really scary. Now, the echo, again, is used to sort of stage and diagnose and then stage these diseases, understand how severe the defect is, does it require correction, and what is the overall prognosis. Unfortunately, things like thoracic x-rays, ECGs, blood work, they don't give us enough answers at many times to fully diagnose the condition and sort of stage the severity. But pleasingly, it's sort of not all doom and gloom for these patients with congenital heart disease. So there are some puppies that have a congenital heart disease that can actually be corrected or significantly improve prognosis and lifespan. And therefore, it's really important to sort of understand which puppies these are and then intervene with them, because if left untreated, sometimes and often they will be terminal. So there are two common defects that can be fixed in most cases. And it's really great because there are many centers around that actually are able to undertake these procedures. So the first one here, this is an echo example of what we call a patent ductus arteriosus. This is a connection between two of the blood vessels in the body, the aorta and the pulmonary artery. This is usually a connection that's present before birth, but when it remains open or patent after birth, and that's this red flow here, and the ductus is actually down here, then if it remains patent open with this flow here, that's when it can cause a problem for the pet. Really good news is that PDAs can usually be fixed by surgery or minimally invasive catheter-based procedures. And however, so that's obviously super great for our pets, but it's important to note if we don't intervene with these patients, a high proportion of them, between up to, well, sometimes about 70% of them, 40 to 70 on average percent of these patients will actually sadly pass away by a year of age. It's been shown in studies. So really important to diagnose that, because long-term outcome of closure of a PDA is usually very, very good with a normal lifespan for these puppies if it's closed. Up here, and these two images here, we have an example of pulmonic stenosis. This is another common defect that we see in puppies. And this condition, the valve, the pulmonic valve, or the area sort of around the pulmonic valve becomes abnormally narrowed, and the heart has to work harder to pump blood out into the pulmonary artery and deliver blood to the lungs. So this extra work causes the muscle, the right ventricle, to thicken, and the heart can dilate over time, and it also becomes sort of less efficient pumping blood, so the blood can begin to sort of back up and congest. So some patients can form right-sided congestive heart failure, which is usually fluid in the belly. Some patients will develop abnormal heart rhythms. and sudden cardiac death. Other patients can have episodes of fainting. And fortunately, that's not all patients with pulmonic stenosis, and more mild stenosis. These patients often can live a normal, happy life. But other patients with more severe stenosis, usually we intervene with, similar to the PDA patients. So in those pets, we undertake usually interventional cardiac procedures. These are under general anesthesia. These are minimally invasive sort of keyhole procedures where we use special catheters and guide wires to access the heart, and the use of fluoroscopy. This is fluoroscopy images here. And that's like a real-time X-ray that allows us to see the heart and then intervene as appropriate and hopefully correct that condition. I will try and play this one again. This patient had pulmonic stenosis. It's a little bit hard to see. This is us injecting contrast into the right side of the heart after it's had the intervention. So if you can see here, that's a stent. So we placed a stent across the area of narrowing, and then we were injecting contrast into the heart to show that there was nice flow out of that previously narrowed area, allowing blood to go into the pulmonary arteries, and then it's coming back round into the left side of the heart. So that was a stent placement for pulmonic stenosis. We also commonly do what's called a balloon valvuloplasty, where we blow up a high pressure balloon to try to break down some of that tethering of the valve in there. This example here was a PDA that was in the process of being closed. This little device here is called an ACDO, or a ductal occluder. We place that across that vessel that remains patent, and this was just pre-release of that little device here, and that allows attenuation or closure of that area, so the blood can thereby not flow through that duct anymore. I've realized it's become very dark in the room here, so I apologize. So now we'll move on to acquired forms of heart diseases that can create a heart murmur. So by far the most common is myxomatous mitral valve disease, or valvular disease, degenerative valve disease. There's lots of different names, all meaning the same thing. This is by far the most common disease in dogs. About 1 in 10 dogs seen by vets in population are diagnosed with heart disease. And then about 75% of those dogs have myxomatous mitral valve disease. We know that this disease is more age and breed related, with smaller breed dogs being the typical culprits. Cavalier King Charles Spaniels, a very common breed that we see with this disease. They typically tend to have it more earlier in life, sadly, and can be faster in progression compared to other breeds. Although small breeds are predominantly the ones that we see with this disease, it's not always that. Large breeds certainly can be affected by this disease, but it's less common. And then, as I said, it's very common as they age. So in one study, up to like 85% of small breed dogs were found to have this degenerative condition by the time they were 13 years old. So that's a significantly higher proportion. So if we think back about the heart again, the mitral valve is located on the left side of the heart, as we said before. And then we have the filling chamber, the left atrium. The blood passes through the mitral valve into the left ventricle. The valve should close, forming a nice seal between the left atrium and the left ventricle. When the blood is then pumped, nice oxygenated blood pumped into the aorta delivering oxygenated blood to the tissues of the body. So that valve should create the seal, which acts to ensure that no blood leaks back into this left atrium. However, in mitral valve disease, that's what we get. And this is that green flow there. Again, when the valve's closing, we've got a leak back into that chamber. And these valves, it's quite interesting. They open and close about 120,000 times each day. That's how many heartbeats often these smaller breed dogs are having in a day. So with this disease, the mitral valve, it starts to degenerate. The valve edges become sort of thickened. You can't see it in this one very easily. But the valve edges become thickened and uneven, and the cords that act sort of as like parachute strings to stop the valve moving abnormally or moving in the wrong direction. So this is the left atrium here. The valve is moving up into that left atrium. It shouldn't be doing that. That's called prolapse. So these cords here, they become abnormally stretched and thickened and can sometimes break. So that's when that valve allows leakage back into the left atrium. That creates increased pressure on this left atrium. And in this one, this is a very enlarged left atrium here. So that's one of the consequences of that leak. And one of the more severe consequences is the congestion in the lungs, or the development of left-sided heart failure, of congestive heart failure. So the patient outcome in this case depends on the severity of the disease. And again, I guess it's sort of not all doom and gloom, because fortunately in many dogs, or most dogs, this is really a slowly progressive disease, and a lot never show signs of disease. But some dogs will, and it's important to recognize these dogs that are likely to develop signs, because now we have medication that's actually useful in slowing down this progression and delaying the onset of adverse events, so clinical signs of heart failure. So if we recognize that a patient is in stage B2 disease, that means that the heart has started to become significantly enlarged, usually. We will start them on a drug called pimobendan. The most common sort of brand name for this is Vetmedin. We've got this little idea of Vetmedin here, the little, lost my pointer again, but you can see that. So Vetmedin is shown to be useful in delaying the onset of symptoms in our stage B2 patients. So these are patients that don't have symptoms, and this drug is capable of delaying the onset of symptoms. So it's a really important drug in these stage B2 patients. Now, if we go on and this disease progresses, and patients develop signs of congestive heart failure, this is when usually we get a fluid in the lungs, and we call this, or term these patients, stage C disease. We will prescribe diuretics and other medications to get rid of the excess fluid. Now, not all, as I said before, not all dogs will reach stage C. So that's a very brief overview of basic medical management. But myxomatous mitral valve disease, although it can be stabilized and sort of initially managed by medication, the very nature of this sort of degenerative aspect of this disease, unfortunately, means patients will continue to decline once stage C has been entered. They require more drugs to be added. The doses will increase over time. And on average, once a patient has entered the stage C, or congestive heart failure, has had an episode of heart failure, the average lifespan, or with a decent quality of life for our patients with medical management, is often between 10 to sort of 12 months or so. So fortunately, now we have more tools in our toolbox. And although medical management was kind of mainstay therapy for treatment of mitral valve disease historically, now we have surgical options that we can discuss with our patients, with our more advanced patients. So we can talk a little bit about mitral valve repair. I'm so sorry I didn't say, if anyone's a bit queasy, please don't look at these slides. So this is a mitral valve repair one that we performed in the UK. And this is a procedure that allows us to halt some of the disease process and over time allows the heart vessels, the heart and sort of related vessels to remodel and return back to a more normal size. It's a repair of the mitral valve, which is based on sort of human techniques, and it consists of usually replacing the ruptured or stretched cords that no longer keep the valve sort of in the correct plane. And then what a procedure that we call an annuloplasty. This sort of counteracts the expansion of the left atrium, which is caused with the valve edges being pulled apart. And that results in sort of more gaps and regurgitation of the blood. So to do this, we place like a continuous suture around where the valve leaflets meet the left atrium and sort of in a circle type structure. And then similar to like pulling a drawstring on your pants, that's sort of what we do at the valve annulus, and that sort of cinches down that valve annulus area back to a more normal size. And then both of these steps combined will allow better contact between the mitral valve leaflets and therefore a much better seal and reducing the regurgitation of the blood back into the atrium. And then that over time allows the heart to shrink back down to a more normal or near normal size. So this video here is us, this is a mitral valve in here. Actually, this is a patient that had mitral dysplasia. It's not actually degenerative valve disease, but that's accessing the valve. So in order to perform the surgery, the heart needs to be still. So we use a heart-lung machine or a cardiopulmonary bypass machine, just like for humans. This stops the heart moving during the surgery. And we remove, well, not we, the surgeon removes the blood from the surgical field, and the heart-lung machine maintains the perfusion and oxygenation of the blood to the rest of the body. This is Big Jeff. He's one of our like earlier mitral valve patients. This is him home after the surgery. He's one of my favorite patients. There's many, but he's certainly one of the more memorable ones. He had a mitral valve repair surgery. So as you can imagine, this procedure, mitral valve repair, requires a lot of specialization and a big team. And at the moment, there's limited access in terms of like there's only a few facilities offering this procedure. And as we've discussed, in order to do a mitral valve repair, we need to have access to the mitral valve. In order to see it and repair it, we need to divert the blood out of the heart, and then need to be on this machine and the heart stopped. So that's an invasive procedure. Really excitingly, there's a new technique that more and more centers or it's becoming more and more available in veterinary centers. And this is a more minimally invasive technique. It's called transcatheter edge-to-edge repair or TEER. This is a beating heart procedure, so no cardiopulmonary bypass is necessary for this procedure. We do need to do a small incision or a mini thoracotomy in order to access the left ventricular apex, this part of the heart, and place a specialized device across into the heart and then across the valve. And then we use this device, it's called a V-clamp. And that's placed across the mitral valve, both sides of the mitral valve, anterior, posterior leaflets, in order to bring the valve leaflets together and clamp them together and minimize the leak. Now, this is, as I said, a beating heart procedure. It's becoming more available. There's a quick recovery. Often they're discharged from the hospital within a few days, and we're becoming better and better at minimizing this leak. This is performed under fluoroscopy and esophageal echocardiography, which is a specialized echocardiogram where we look at the heart through the esophagus. It does require a general anesthetic to place this probe. So this is super, super exciting. Myself and a couple of my colleagues went across to Shanghai this year to do some training for the V-clamp or tear procedure. The Shanghai team, Hongyu Medical, they developed the canine-specific V-clamp device. So yeah, this is a really cool technique. Oh, I didn't play the video, but this is a transesophageal echocardiogram where we're placing the device or manipulating the device, and we look under sort of many different modes of echo. So we use 3D echo as well. This is an example of that. Was clicking through an example of 3D echo, and that's the valve and the device coming into the area of the valve. Now we're going to change tune a little bit. I realize we've been talking a lot about dogs here. I want to mention cats, of course, because cats certainly can have heart disease and heart murmurs. Cats can be a bit tricky because they can hide their heart disease quite well, and detecting heart disease can be quite difficult in these patients and sometimes. So cats often don't show signs of heart disease until heart disease can be very advanced. And I mentioned that they're challenging because not all cats with heart disease will have a heart murmur. So it can delay our diagnosis sometimes in patients. This scan here, this echo here, is a patient with very advanced heart disease. He has very enlarged atria, the heart muscle's not pumping very well, and this patient didn't have a heart murmur. So I mentioned cats because they, yes, as I mentioned, it can be quite challenging. In terms of echoes for a cat, this is done in the same way as in dogs. We have a nice soft table, really try and keep the stress to a minimum. We really love giving gabapentin to cats prior to echoes. It doesn't affect our echo images or our ability to diagnose. It does reduce anxiety or wind up for cats. So I really like that prior to an echo in patients that are a little bit more stressed. Cats as well, they can have congenital heart murmurs. So pretty commonly, or more common, congenital heart disease is a ventricular septal defect or a hole in the heart. This is actually, I keep losing my mouse here. This top picture is an example of a hole in the heart. It's a bit more of a complex congenital heart disease. So some patients will have congenital heart defects that will never show, the patients will never show symptoms and live completely normal life, no treatment necessary. Whereas others, just like dogs, can begin to show symptoms as a consequence of their heart defect and require treatment. Often in cats, that's medical treatment. However, there are some surgical options available in some feline patients. So heart murmurs in cats, again, make it challenging because heart murmurs are very common in cats. In one study out of the UK, the CAT scan study, they looked at 780 apparently healthy cats, and they found that the overall prevalence of a heart murmur was 30 to 40% of these patients. So the challenge is that some of these patients have a benign heart murmur and some of them are indicative of heart muscle disease, or what we call cardiomyopathy, usually in cats. What they did find from that study was that patients that were younger were more likely to have a benign murmur, kind of similar to dogs, I guess. And then as they get older, the proportion of heart murmurs related to heart disease increased. And as I said before, not all cats with heart disease will have a heart murmur. The cats are really the principal cause of sort of cardiovascular morbidity and mortality are cardiomyopathies, with HCM or hypertrophic cardiomyopathy being the most common disease within the cardiomyopathy spectrum, and not all of those patients will have heart murmurs. And this is quite a prevalent disease in cats. Some studies suggest about 15% of all cats will have HCM. It's characterized by a thickening or hypertrophy of the heart muscle, or the ventricles, the lower chambers of the heart. This is the left ventricle here in long axis, and the left ventricle here in short axis, and this is a thickened muscle. So what happens is that heart muscle thickening impedes the filling of blood into the chambers of the heart. And over time, the heart can become progressively enlarged with sort of increased pressure within the heart chambers. Now, again, fortunately, the majority of cats with cardiomyopathies or HCM are likely to remain preclinical, meaning they will be free from from signs or symptoms of disease and will have a normal life expectancy. However, a proportion of these patients with HCM or cardiomyopathies will experience serious consequences. One of these serious consequences that we can see is aortic thromboembolism. This is a term used for the development of a blood clot that travels from the heart. There's the clot there, or thrombus there, sitting in the left atrium or the left auricular appendage here. So that clot can move out of the heart and travel to different organs or areas in the body. And the most common place that we see these emboli or to lodge, these clots to lodge are the hind limbs, what we call a saddle thrombus. So this video was showing a patient with a saddle thrombus. So some patients, really having these serious consequences. Other consequences of heart disease can be things that we've sort of also mentioned previously. A lot of these relate to breathing. If your pet is having difficulty breathing, you can see in this patient, I'm going to play it again, but you can see how much effort that cat is putting into breathing. You see his belly, there's a lot of movement there, recruiting of these muscles to try and increase airflow. So that's a patient with dyspnea or difficulty breathing. Other signs that are concerning could, and particularly in cats, might be like open mouth breathing, discoloration of their gums, so the gums turning blue or pale, if we have a pet that's collapsed or fainted, particularly if it's happening multiple times and it's happening with a prolonged recovery time. Coughing up a frothy liquid could indicate signs of congestive heart failure. And then as we look at these cats, the sudden inability to use legs, often the back legs, sometimes the front legs. And then again, sometimes some more like non-specific signs. So patient stopped eating, it has lots of vomiting, reduced appetite or diarrhea. Sorry, these could be more non-specific signs. And we also may want to understand how our pet's kidneys are functioning if they're on diuretics. So we usually encourage pets with heart disease for you at home to monitor a breathing rate and effort. So pets with heart disease often have an increased breathing rate and or sort of effort. And this is something that we can like easily monitor at home. We watch each breath, the rise and fall of each breath is each inspiration and expiration, that's counted as one breath. Then we determine the rate and also the effort of these pets breathing. We want to do this in a calm environment where the pet's resting or ideally sleeping. And then we want to count the amount of breaths that the pet is having over a minute. We call it a minute breathing rate. Normally, in a normal cat and dog, the breathing rate is usually less than about 30 breaths per minute. Can be quite low, even down to sort of 10 or 12 breaths per minute in some patients. And what we're worried about or worried about monitoring in these patients is if we start to have fluid accumulating in the lungs, the breathing rate will start to get faster, and potentially more effort involved in breathing. So you may see those changes with the expansion of the ribs and the contraction of the belly muscles every time the pet breathes. So a normal breathing rate in a normal patient or a patient with well-controlled heart disease will usually be less than 30 breaths per minute. And we're wanting you to sort of notify us or let us know if that rate's increasing over sort of 35 to 40 breaths per minute. We would want to have a chat and see if we need to get that pet in, certainly. If we're having open mouth breathing or those sort of nostrils billowing out, lips billowing out with each inspiration, expiration, that's a sign of increased effort. I just wanted to touch a little bit on one sort of last thing. And this is something I guess, one common sort of question or presentation. We have an older pet come in with a heart murmur, needing a surgical procedure. Often that's a dental, and they have a heart murmur. And in these patients, what we're wanting to try and do to sort of assess their risk for anesthesia is to try and understand what we've gone through before. Firstly, so in trying to understand, yes, this patient is a good candidate or is a worrisome candidate for anesthesia, we're wanting to firstly understand what is the diagnosis for this patient. Does this patient, is it an older patient? Does it have mitral valve disease? If it does have mitral valve disease, what stage is that mitral valve disease? Does it need to be on pimobendan? Has the patient previously been or is in active heart failure? So these questions can be answered or more information can be provided by echo and chest x-rays to try and understand each pet and their sort of physical status in order to understand whether these are reasonable patients to undergo an anesthetic. So that kind of concludes the chat. And yeah, I just wanted to say, yes, I travel all over Monterey, Santa Cruz counties, even up to East Bay. We do work really closely with your primary veterinarian to look at any patient, whether that's a breed screening, an arrhythmia assessment, heart murmur assessment, patients showing signs of heart disease. So yeah, work really closely with your normal vet to get a plan in place and understand prognosis for these pets. And we're also opening up these little pop-up clinics as well, which we hope to start having a few around different areas. And yeah, I guess like I'm really passionate to try and provide care to our pets. Like it's hard to know that there's a lengthy waiting list sometimes for our pets to see have specialist care or cardiology care. So hopefully that providing these sort of pop-up clinics as well may reduce waiting times and allow accessible care to our patients that need cardiology assessment. So thank you very, very much. I realize it's extremely dark in this room. I'm going to turn on the light. My apologies before we ask the question. So I'm going to move it on.
Well, and I apologize that I didn't do the housekeeping part where anyone attending can put their questions either in the chat or in the Q&A. So I probably, and my apologies for not saying that sooner, but you're welcome to ask your questions and we'll do our best to answer. That was so informative. I think it's really lovely for people to understand what heart disease is, and that it's not just a blanket thing, that there's parts of the heart that start to dysfunction. And I can't emphasize enough how cats like to hide heart disease. I think that that's a very, very valuable thing. And a lot of people will not realize that some of their cats' behavior is a hidden heart disease, because cats are good at like, I'm fine, everything's fine here, no problem here. So we have to check on them with a lot more frequency.
That's exactly right. And the area of cardiology is always evolving. So there's all these cool new techniques. That's super exciting. And hopefully it means we can provide better care and better outcomes for our pets, increase their quality of life, improve quality of life. That's what all of us aim for.
Yeah. And I think that's a big part of, as our mission for BirchBark, the threefold mission: financial support for low-income people who can't afford fixing their pets, but education so that we can be the best advocates for our pets that we love so much, and then grief support as our third mission. So this is one of those missions, to make sure that people have all the data, or as much data as possible, to be advocates for their pets. So thank you for being part of that. We've got a couple. Sure, it's lovely. And the first two comments are so informative. Thank you so much. And incredible, wonderful amount of information. And then we have a question: can heart murmurs in dogs be reversed or diminished?
Well, I guess firstly, heart murmurs in dogs sometimes can be transient. So in those patients, it's more common in cats, but certainly we can see it in dogs. So patients that have like these murmurs induced by excitement or stress, the cats, typically we have this dynamic right ventricular outflow tract obstruction. That's a big long name for usually a benign murmur. So those patients, when they're like relaxed, lower heart rates, these murmurs can completely disappear in some patients. And similarly, these more benign physiological murmurs can disappear in dogs too, or not be present all the time. One, I guess, sort of, in a sense, pimabendin is effective at, so this medication for B2 or more advanced mitral valve disease patients. Pimabendin can help to remodel or sometimes shrink the heart size. And sometimes, that certainly can potentially affect the murmur grade as well. other times murmurs might be reversible. It will be in our congenital disease patients. So if we have a PDA, so that persistent patent ductus arteriosus, that persistent flow of blood through the vessel, the fetal vessel. If we put an ACDO or a ductal occluder in there, that will stop or attenuate the blood flow. So we'll completely lose those murmurs. Conversely, in our pulmonic stenosis patients, if we go in and balloon them or place a stent, sometimes we can even create more of a heart murmur or a different type of heart murmur, diastolic heart murmur, but that still leads usually to a better prognosis. So there's a few ways that murmurs can sort of change in dogs or cats, yes.
Yeah, I think I like that. It's sometimes is a good answer and depends on the cause of the murmur. And you covered that beautifully, I think, on those different diseases. And this one is kind of a general question. My German Shepherd pants a lot and doesn't like to take walks anymore. He wears out soon. He's 7 years old. Is this indicative of heart disease, or does he just get hot? And certainly, as the internal medicine specialist, I can say that should be checked out and potentially heart disease, but not, those signs aren't specific to heart disease. Dr. McDonald, do you have any?
Yeah, I would say we didn't touch on, I don't want to scare anybody, I just want to in general inform, but we didn't touch on some of the other common conditions or heart muscle diseases in dogs, one of which is dilated cardiomyopathy. That's typically something we can see in like more large breed dogs or giant breed dogs. And these patients don't necessarily have a heart murmur. So there are some diseases where I'm not sure if your pet has been diagnosed with a heart murmur, and if they have, certainly an echo would be useful to understand more about the pet. But if the pet doesn't have a heart murmur and it's a large breed dog and there's signs of exercise intolerance or changes in the breathing pattern, then potentially, certainly further workup and potentially an echo would be useful to understand if there are any changes in the heart size or function in that patient without even having a heart murmur.
Yeah. And I think that's a great dog for a chest film, because it allows you to look at the heart shadow and the lungs. And, a 7-year-old German Shepherd could just say, I don't want to exercise as much, or even can have orthopedic disease, doesn't want, but the panting a lot and reluctance to exercise certainly warrants checking those things out for sure.
Yes, I agree.
Yeah. Let's see. It looks like I have to scroll down here to get more questions. And I have my Zoom bombing cat contributing. She does not have a heart murmur. But she likes to be part of any video. So the next question is, what's the general prognosis for an 11-year-old min pin with stage 5 murmur and now on pimobendin? That's a hard question to answer because it's so unique to each pet.
Yes. I guess like in general, so I would say the stage 5 heart murmur, it's really the intensity of the heart murmur or the grade of the heart murmur. So we do know that usually the intensity or grade of heart murmur, so the higher the heart murmur, often the potentially more advanced the diseases, but not in all cases. But this patient's on pimobendin, so has been diagnosed by someone as being in stage B2 disease, meaning that the patient has some enlargement of the left atrium, the left ventricle. Those are the indications of starting pimobendin. Pimobendin is the drug that I mentioned before is useful in delaying onset of symptoms, and namely sort of congestive heart failure. And on average, this prolongs that time in those patients by an additional 15 months. So when a patient first gets diagnosed with stage B2 disease, it may be a few years before going into stage C if they're going to progress to that. And not all dogs will progress to that. Some stage B2 is quite a wide and widely encompassing stage. We can have patients with very minimal enlargement of the heart, so just sit over what we classify as enlarged, to very, very enlarged hearts. And we don't kind of sub-classify that at the moment. But if a patient has a significant enlargement of the heart, really enlarged left atrium, left ventricle, then they're more advanced in that stage B2 and would be potentially likely closer to going into congestive heart failure or showing signs of disease. And then once we have a patient go into congestive heart failure, if they're going to do so, on average, we can medicate them. This is talking about medical therapy, diuretics, amongst other medications, up titrating, intensifying drugs. On average, we can treat them at that stage with a good quality of life, which is our aim for 9, 10 to 12 months, sometimes longer. So stage B2 patients may always stay stage B2. If they go into stage C, it's often, a couple of years after they've been diagnosed with that. And then depending on how advanced they are when they're diagnosed with stage B2. And then if they're in stage C, then on average, we can treat them, say, for about a year. And at that point, their disease may be very advanced.
Yeah, and with that terminology of after going into stage C, on average, we say a year, that's median survival, right? So there's a lot that make it past that, but there's some that advance faster. Yeah.
Exactly. There's a huge amount of variation. The disease, they all affect, it's an individual, each individual is affected differently. So some patients may very suddenly rupture one of those cords that hold the valve from really prolapsing or moving into that top chamber, and very suddenly they can deteriorate. Other patients can go on to develop abnormal heart rhythms, which affect their prognosis, atrial fibrillation. So each patient is a little bit individual. That's why, we sort of tailor therapy based on their progression and how their kidneys are tolerating their medications, what their blood pressure is, what their heart rhythm's doing. So yes, that's a pretty varied spectrum just an average estimate there.
Yeah. And I think the question about the Min Pin, the 11-year-old mini Pomeranian, it's a 28-pound dog, was the B2 just diagnosed, and we've got years of B2 before you actually reach that stage C. And I think that's an important part of answering that question, right?
And I guess, as I did mention, like some patients will never go into developing heart failure, and those are likely those patients with sort of less remodeling of the heart. They may stay in stage B2 for their entire life. So then therefore they may pass away from something else eventually. So it's not a terminal diagnosis by all means in all patients. And even if it is more advanced, there are certainly things that we can do to effectively treat the patients.
Yeah, thank you. That was a tough question because it's hard to know that, but there's lots of wonderful variables that you've already discussed in your presentation that help everyone understand that. And our last question, is somebody who said, I was amazed to learn about the innovations in heart surgeries and valve replacements. And are these all cardiologists that are doing these interventional procedures, or are there some surgeons involved?
Definitely surgeons involved. And our team in the UK, we had our cardiac surgeon, so a soft tissue surgeon, Dr. Poppy Bristow, and Yes, so they will usually be performing the actual surgical procedure. Us as cardiologists, our main involvement is diagnosis, management prior to the surgery, management post-surgery, and then throughout the actual procedure, we will be looking at the heart at certain times with their transesophageal echocardiogram that allows us to really get a good idea of how the valve looks. And then we're looking for sort of concerns after, as the procedure is going on, or at the end of the procedure too. So our involvement, and then I guess the other sort of side of well, it's a big team, so there's obviously a strong anesthesiology team, and then there's the perfusion team as well, which is a highly specialized area, and certainly very specific to the dog niche. So compared to there is obviously similarities with humans, but they have some very dog specific things in perfusion. Certainly not my area of expertise, I would say.
Well, and I don't know, I know we've had a client when I worked at the 24-hour hospital who took her dog to Tokyo for when it was right when the mitral valve surgeries were.
Yeah.
Successfully done, but there's multiple places now in the United States. Florida's the only place?
Yes, University of Florida is one of the newest centers, so it's super exciting because, like, I've kind of lost track of time, but prior to about a year ago or so now, there were no centers in the US. Japan, UK, and France have been the main countries or areas rather that have been offering this procedure. But now it's great because we've got Florida, although it's not just down the road from California, I guess. But certainly in the UK, we were used to having patients travel from the US to us. So yeah.
Okay. Yeah, it's really exciting stuff. The progress.
Yes, it is. And same with the TEER procedure. And I guess to sort of answer that question, in terms of like who's involved with that, there's an anesthesia team, then we'll have a person dedicated to the transesophageal echo, which is a major part of the direction of the device and deployment of the device. There's usually a surgeon that will do the mini thoracotomy, so the hole in the small hole in the side of the chest wall, and then the interventional cardiologist will place the device usually, or a combination of the surgeon and interventional cardiologist. So we're sort of moving into heart teams, if you like, which is sort of multidisciplinary for these new innovative procedures, which is really nice to have this multidisciplinary approach, and therefore like provides better outcomes for our patients as well.
Yeah, and there's that lovely mix of experience on the team where everyone can bring experience together. So that's great. And is the TEER option in California yet, or still only in Florida?
Mm-hmm. Mm-hmm. Oh. Colorado, the University of Colorado have, I guess, been like the pioneers in bringing that to veterinary medicine, but they are training a number of centers. And yes, the closest center is in LA. So there's that option, and there's a few centers there performing the procedure. The team that I showed, some of my colleagues, they were from LA. So there's a couple of teams there. But yes, various states will have the TEER accessibility.
Okay, great. Well, lots of positive feedback here on the Q&A, where people are just saying thanks for the great amount of information. And we are grateful for you sharing all of that and helping us get a little more information about how to watch and monitor our pets, and from the heart, if you will.
Well, thank you very much. It's been like absolute pleasure to chat. And yes, I mean, I have put my email there, so if people do have questions that they don't want to pop in the chat then, or about their pet, yeah, I'm also happy to help answer as best as I can too. So thank you.
Great. Thank you so much. We are very grateful, and this has been fantastic. So thank you.
I hope everybody has a good evening. Thank you.
Yeah, and hope the surf's great for you this weekend.
Yes, me too. Thank you very much. Okay.
Okay, take care.
Good night, everybody.
Bye-bye.